Okay, hello everybody. I'm Dana Treichler, Adult Services Librarian with Princeton Public Library. It's my pleasure to welcome you to this afternoon's Medicare workshop presented in partnership with Princeton Senior Resource Center. First, I want to thank you for attending virtually on Zoom. Some people unexpectedly, as we were having some work done to our AC system in the library. So I appreciate everybody last minute pivoting to this virtual only session. We're lucky to be joined by Roderick Spann from Senior Advisors today. Roderick will be delving into the ins and outs of Medicare, some pitfalls, things to be on the lookout for, and much more. Before I turn things over to him, I just have a couple housekeeping items to mention. First, the program is being recorded and will be uploaded to our YouTube channel in a few days. So feel free to reach out to me or be on the lookout for that if you have to refer back or want to share it with anybody. Second, if for any questions, please use the Q&A feature at the bottom of your screen. We will be monitoring it throughout the program, and there will be time at the end to ask questions. All right, it is now my pleasure to turn things over to Rod.
Awesome. Thanks so much for the intro, Dana. And thank you all for taking time out of your schedules to join us. I'll share my screen here. Hopefully that was a smooth transition. And we'll try to get things started. Again, as Dana mentioned, my name is Roderick Spann. Our company is called Senior Advisors. We work specifically in the Medicare space. So we help folks who are just going on to Medicare, or perhaps they've been on Medicare for a number of years and they're trying to figure out if they're still in the most appropriate plan for them. We focus on all areas of Medicare. I've personally been with the company for about 3 years. But the company itself has been in business for 30 plus years, starting off in the small group insurance benefits space. And then back in 2009, we didn't really have a resource for folks who were aging off of that small group plan, and they had questions about Medicare. So we told them, hey, just go call Blue Cross Blue Shield or United Healthcare and see if you can get an answer from them. But if you've ever experienced calling one of these large companies, you realize how much of a nightmare that can actually be, on how difficult that can be. So that's where Senior Advisors was born, basically as a resource. So our founder is Doug. He runs the company with his son, Justin, and they let me tag along and do workshops like this, which I love doing. We do about 40 to 50 of these workshops, either in person or on Zoom every single year. All right, so let me get over here. Again, we were founded in 2009. Right now, we're helping over 25,000 people with their Medicare plans. Right now, it should be closer to 30,000 people, not just here in New Jersey, but also in 40 other states. We are family owned and operated, and we're also members of the National Association of, it used to be Health Underwriters, but now it's Benefit Insurance Professionals, which is the organization that really rallies when it comes to the government side, the legislative side, for changes to the Medicare system. Right, there's been a lot of issues with Medicare for a number of years, and so this organization really works hard to, on behalf of beneficiaries like yourself, to get some of those necessary changes made. So that's what we do. We have 3 offices, one in South Jersey, which is down in Morristown, which is not Morristown. I'm not originally from New Jersey, so it took me a while to get that figured out. So Morristown is our one office. I work out of the Cranford, New Jersey office, which is our central Jersey, and then we also have an office out in Phoenix, Arizona. So those are our 3 places where we work. And again, we're licensed in right now 40 states. We should update this map. So we help folks all over. So what is it exactly that we do here at? Are we muted with video off? Can everyone hear me okay? Can you hear me okay, Dana?
Yep, I can hear you.
You can hear me? Okay. All right. Someone asked the question, are we muted with video off? So, all right. So what exactly do we do here at Senior Advisors? Well, first and foremost, we educate. Like I mentioned, we do about 40 to 50 of these Medicare workshops every single year, focusing on the educational aspect, understanding what your options are when it comes to Medicare, and how understanding your options will empower you to make a good decision, right? Medicare is not one size fits all. And with all the material that you'll probably get in the mail, the closer you get to 65, with all the commercials and all of your friends who may have advice for you, it can be very confusing. So we do educational workshops like this to help make that decision a lot clearer. Secondly, we provide options. We are brokers, so we work on behalf of you, the beneficiary, but we do that by contracting with all the major health insurance carriers. So according to your situation, we can point you in the right direction. And then lastly, we assist with enrollment. So we basically hold your hand throughout the entire process, whether that's enrolling in Part A and Part B, when you need to do that, trying to figure out, which, Medicare supplement may work for you, may make the most sense. Or if you want to go the private healthcare option, which is Medicare Advantage, trying to figure that out for you as well, which plan may make sense. And then we also help a lot with the Part D prescription drug plans, as well as lowering your prescription drug co-payments through different programs. So this is what we do. We educate, we provide options, and we assist with enrollment. So today's workshop is going to cover 3 main sections. The first section is a little bit of Medicare 101. So I apologize for anyone who's out there who's been on Medicare already. It's going to be a bit redundant, but maybe you'll learn some things you didn't know. And then we'll also go into Medicare supplements, specifically the difference between Medicare supplements and Medicare Advantage. What are the similarities and what are the key differences? Section 2 is all about Part D, prescription drug costs. Basically, why are prescriptions so expensive? And we'll also touch a little bit on the Inflation Reduction Act that was passed last year, because it did have some major impacts on Part D prescription drug plans, not just this year, but for the next 5 to 10 years. So we'll delve into what those changes are, how that impacts us. And then lastly, Section 3 will recap the top 5 mistakes that people make. All right. So we'll get into it with a little bit of Medicare 101. So these are the 4 basic parts of Medicare: Part A, Part B, Part C, and Part D. Now, Part A of Medicare is your hospital insurance. So that's everything that takes place inside of the hospital. It's your room and board, it's your nursing care. It also covers if you're transferred to a skilled nursing facility. So when it comes to Medicare, if you've been in the hospital for 3 days, 2 nights, let's say for a knee surgery or a shoulder replacement, if you're transferred to a skilled nursing facility, that falls under the Medicare guidelines of Part A. So Medicare Part A covers that skilled nursing care, also hospice care, and limited home health care. It does not cover long-term care, like a nursing home or anything like that, nor does it cover custodial care. But skilled nursing facility, which is basically a rehab. Part B of Medicare is everything outside of the hospital. So this is your doctor's visits, all preventative services, durable medical equipment, testing, expensive things like chemotherapy, kidney dialysis. All of this falls under Part B of Medicare. Now, Part A and Part B of Medicare are considered original Medicare. Right, when the Medicare program first went into action back in 1965, this was what the Medicare program was: hospital insurance and medical insurance. Now we have Part C of Medicare. That was a later addition to the Medicare program, and it's a bit of a misnomer because Part C is referred to as Medicare Advantage. And it's a misnomer because Medicare Advantage really isn't Medicare at all. This is the fully privatized option in which the government, transfers that responsibility and that risk over to these private companies. So now it's just another way for you to get your Part A and B benefits, but it's fully managed and administered through these private companies, through United Healthcare, through Aetna, through Braven, through all these different companies, and they're the ones that are responsible for your healthcare. And then lastly, which is kind of wild when you think about it, Part D was the last addition to the Medicare program. Before 2003, there really wasn't drug coverage built into any of these plans. But Part D assists through again, private companies to offset the cost of your prescription drugs. And this is run by private insurance companies. And basically, in exchange for a premium, you're supposed to get at least lower drug costs, lower than the retail drug cost. All right, so those are the 4 parts of Medicare: Part A, which is hospital insurance, Part B, medical insurance, Part C, also known as Medicare Advantage, and Part D for drugs, prescription drug coverage. Now, the premiums for all of these plans are going to vary, but if we look at the very bottom there of our slide, Part A generally has no premium. And the reason for this is if you've worked, you or your spouse have worked at least 10 years or 40 quarters in the eyes of Social Security, Part A has no premium. It's $0. If you haven't met that criteria, if you haven't worked at least 10 years or 40 quarters, then Part A is actually pretty expensive. This year, it's about $500 a month. Part B has a base premium that is income adjusted. And we'll get into some of those income adjustments on the next slide, but the base premium this year is $164.90. Now, generally, this is the first part where people's jaw drops, or they start to say, hey, I thought Medicare was free, right? I've been paying into the Medicare system all these years. I thought Medicare was free, but the reality is Medicare is a pay-as-you-go system, very similar to Social Security. And for Part B services, these are the premiums that are adjusted every single year. And the reality is the more money you make, as we'll see in the next slide, the more that Part B premium can actually increase. But for the majority of Medicare beneficiaries, they're paying that $164.90 per month. Part C, Medicare Advantage, these premiums are generally going to vary as well. When you stop and think for a moment about these commercials, right? The William Shatners of the world, J.J. Walker, Joe Namath, how much are they saying these premiums cost for these plans? Well, generally they're touting $0, right? And that's what we normally see for Medicare Advantage plans. The majority of them are going to be $0 per month. There are some that are $30, $50, $100. I've seen some over $200 per month, these fully managed plans, but the majority of them are going to be $0. And we'll get into why that is, right? Because we're all adults here. We understand that nothing in this world is free. So we'll answer the question, how can these plans be $0 per month? And then lastly, Part D, prescription drug coverage. These plans are also going to vary, and they're also income adjusted. The plans this year range from $5 a month to over $100 a month. And it's all based on the particular formulary or list of drugs that each of these plans cover. Now, the government does regulate that each plan covers at least 2 medications in every therapeutic category. But some plans carry more, some carry, just the bare minimum. And then the type of drugs that they cover is really going to determine their premium. And again, Part B and Part D of Medicare are income adjusted. So what are those income adjustments? Well, here you'll see them, and they're referred to as IRMAs, income-related monthly adjustment amounts. All right. It's a mouthful. We'll just call it IRMA. All right. We don't need to get too far into these numbers, but basically you'll see there's 6 different tiers that a person can fall in. Again, the majority of people or the majority of Medicare beneficiaries fall into this first tier, right? If you're a single tax filer and you're under $97,000 a year, you pay the base premium of $164.90. If you file your taxes jointly and you're under $194,000, then you pay the base premium as well. Now, if you're in a higher tax bracket, let's say you're in tier 6 as a single tax filer making over $500,000, or as a joint tax filer making over $750,000, I say that's a good problem to have, but that Part B premium is going to increase pretty significantly, right? And that premium goes all the way up to $560.50. And this is per person per month, because even though they're looking at your joint tax returns, Medicare is a individualized system. So it's based on, it's going to be your premium. And, the next question most people ask is, what are they basing this income on? Well, it's the last completed tax return that they have on file. Obviously, they don't have 2022 because most people just filed their 2022 tax returns and the government's still working their way through that. So the IRMAs, or these income adjustments, are always 2 years delayed. So if anyone's signing up for Medicare this year, 2023, they're looking at 2021's tax returns, and they're looking specifically at your modified adjusted gross income. Now, for most people, their modified adjusted gross income is the same as their adjusted gross income, but that's not always the case. And I'm not an accountant, so don't quote me on it. I would check with your accountant to figure out what your modified adjusted gross income is, and that will determine which bracket you would be in. And as we mentioned, the IRMA, or the income adjustment, is not just for Part B, but also for Part D. So the numbers are still the same. The tiers are still the same. But basically, if you're in tier 1, all you pay is your premium. Whatever plan we find that's most appropriate for you, you pay your premium and that's it. If you're in a higher tax bracket, let's say you're in tier 2, then you pay your plan premium plus an extra $12.20, all the way up to the highest bracket of $76.40 per month per person. All right, so that's how it works. That's how these income related monthly adjustment amounts work. And basically, this is just a slide showing both of those numbers combined. Just makes it very simple to understand, because obviously, if you're signing up for Part B, you're obviously going to get Part D drug coverage. So you're going to have to pay both sets of IRMAs for Part B and Part D. Now, what if the money you're making now in 2023 is less than the money you made in 2021? Well, that's often the case when we're working with folks, working with our clients. Often they're coming to us because they're looking to retire, or there's a work reduction, and the income they're making now is not the same. Should they still have to pay that IRMA? Well, thankfully, the government has a little bit of understanding in this regard, and you do have the ability to appeal that IRMA. And it's a pretty straightforward process. This form right here, SSA 44, is the life-changing event form to appeal your IRMA. Basically, if you are subject, or you have any of these 8 life-changing events, oftentimes it's going to be a work stoppage or work reduction. If you fill that out and you put down your estimated income for the year, you don't need to provide any documentation, because obviously 2 years later, when they get your tax return, they'll verify what you put on this paper. And if it ends up being more, or putting into another tier, then the government's going to come back for it. But we're being honest here. We're putting down that, hey, there's been a work reduction, a work stoppage. I'm not going to make the same this year as I did the year before. This is my estimated income. You send this in, and the government will adjust your monthly premium to whichever tier you fall into. They'll take your word for it. No documentation needed. And it's a great way. We work with a lot of our clients to appeal this IRMA, because unfortunately, we've also talked to a lot of people that did not know that this was a possibility, and they've just been paying the IRMA, even though they're making less money in retirement. So this is an excellent tool and an excellent way to ensure you're not paying too much for your Medicare plans. All right. So the initial enrollment period, when Medicare first started back in 1965, times were different then. A lot of people were retiring at that time. Nowadays, more people are working past the age of 65 than really ever before. But still, the initial enrollment period revolves around a person's 65th birthday. It's the 7-month window surrounding your 65th birthday. Now, for most people, this is when they're going to enroll in Medicare. And I say most because it doesn't mean just because you're 65, you have to enroll in Medicare. We'll get into that scenario in the next screen. But if you're in a situation where you're about to turn 65, you have health insurance, but it's through the individual market. And it's not a group plan where it's a large group, which means over 20 employees. If you don't have, if you have, small group insurance or individual insurance, then this is when you're going to enroll in Medicare. And you're generally going to want to do it the 3 months before you turn 65, because if you enroll in the 3 months before you turn 65, in this example, their date of birth is September 10th. Their eligibility date is always going to be the first of the month. So their enrollment window starts in June. If you sign up in June, July, or August, your Medicare will start September 1st. Now, if you're in that scenario where you have no insurance, or you have individual health insurance through like the government marketplace, or you're covered under a small group insurance policy with less than 20 employees, and you miss this window, then you're going to be subject to the 10% Part B penalty, which is a penalty for not enrolling in Part B on time. And it's a 10% penalty that sticks with you not for a month, not for a year, but for the rest of your life. So if you find yourself in this situation, most people are going to enroll in Medicare at this time. All right, we have a question. So my husband has insurance through work. Since his insurance also covers our college-age daughter and me, he will continue to work through June 2025, when he will be 66 years old and I will be 65. I understand that he must sign up for Medicare at 65. If he shows a proof of insurance through his work, can he delay signing up for Medicare until he retires? Yes. And good question. So as long as his group insurance has more than 20 employees, which we'll get into in this next slide, then he actually doesn't have to do anything with Medicare, right? If he is over the age of 65 and covered by a large group plan, which we'll get into in page 13, then he does not have to do anything with Medicare. And we'll get into how he would sign up for Medicare later. All right, awesome. Okay, thanks so much, Ann. So great question. This does come up a lot, right? Because you may be hearing from all of your friends, even your HR departments, telling you have to do Medicare at 65. And for some people, that is the case, but not always. And the maybe is based on what's called the secondary payer rule. So the secondary payer rule basically just helps to quantify who is going to pay first, who is going to be responsible for roughly 80% of your medical claims, right? And it's very straightforward. If we look here, if you're over the age of 65, you're on a group plan. Let's see, if you're over the age of 65, you're on a group plan and the employer has less than 20 employees. So in the eyes of the government, that's a small group plan. If they have less than 20 employees, then Medicare is going to be your primary payer. So if Medicare is your primary payer, that means you have to enroll in Medicare, all right? So even if you are still working, if they're a small group, then you have to go on Medicare, all right? The second tier is same scenario. You're over the age of 65, but now the employer has more than 20 employees, even 21 employees. Well, in the eyes of the government, that's a large group plan. And the large group plan still pays first. So if the group plan pays first, you're not required to do anything with Medicare, right? You don't even need to sign up for Part A. You can, right? Because Part A is free. But you're not required to enroll in Part A or Part B because the group plan is still primary. And in my humble opinion, right, in our experience, Medicare is not a great secondary, right? Medicare does not coordinate on the secondary end very well when it comes to the employer group plan. All right, another question. What is the definition of signing up for Medicare? I'm currently 66 and signed up for Medicare at 65. But only Part A, given that my wife is still working for Princeton University. So I didn't sign up for Part B. So am I signed up? Okay, good question, Michael. So when I say sign up for Medicare, it does include Part A and Part B, but more specifically Part B, because Part B is where the premium comes in. If you sign up for Part A, there is no premium attached to it. The only downside is if you have a high deductible health plan and you're contributing to an HSA, if you sign up for Part A, you can no longer contribute to the HSA. So that's the only downside to signing up for Part A before you leave group health plan. But when I say sign up for Medicare, I'm really saying completely all the way, sign up for Part A and Part B. You start paying that Part B premium to the government, right? Doing that before you leave a group health plan doesn't really make sense. Michael, you made the right choice. All right, good question. Now, these numbers change just a little bit when it comes to disability. With Medicare, generally, you're signing up for Medicare when you're turning 65. But you can also qualify for Medicare at an earlier age. There's three other scenarios. One, if you're diagnosed with ALS, Lou Gehrig's disease, if you're diagnosed with end-stage renal disease and you're on dialysis, and third, if you are on Social Security disability for 24 months, 2 years. In that 25th month, you automatically get enrolled in Medicare. Now for this, the number changes from 20 to 100. So if you're on disability and Medicare, if you're on disability and you're under 100 employees, then Medicare becomes the primary. You have to enroll in Medicare. If there are over 100 employees, then you're not required to enroll in Medicare. You can keep that group health plan, either yours or your spouse's. And the same is true when it comes to retirement plans and with COBRA plans. On here, we get a lot of questions with retirement plan. Let's say you retired at 55 or 60 and your retirement plan is working great. You love it. When you turn 65, in order for you to keep that plan you love, you are required to enroll in Medicare, because with every retirement policy, other than federal employees, Medicare is going to be the primary payer. So in order to keep that plan and for it to pay its secondary, to pay as a secondary, you have to enroll in Medicare. The same is true when it comes to COBRA. COBRA being that continuation of health coverage after you've left an employer, generally anywhere from 18 to 36 months, depending on the scenario. If you are over the age of 65 and you go on COBRA and you're entitled to Medicare, Medicare is actually the primary. And this is kind of a big issue. We refer to it as the COBRA trap, because they don't really make this clear when they send out paperwork to COBRA, for COBRA. If you're under the age of 65 and you signed up for COBRA, it's fine. But if you're over the age of 65 and you sign up for COBRA and you don't sign up for Medicare, then that's where you find yourself in this COBRA trap. This is where you're going to be paying 100% of your premium for COBRA, but COBRA isn't really responsible for 80% of your claims, right? So even though you're going to pay that monthly premium, by law, they're only responsible as a secondary. So if something were to happen, if you were to get sick, if you needed to have surgery for some sort or for some reason, they can, and we've seen it, send the bills right back to you and said, hey, you were eligible for Medicare. You should have enrolled in Medicare, right? There was a case not that long ago. A gentleman, he went on COBRA. He left his job. He was eligible for Medicare, but he didn't know. He wasn't sure that that's what he had to do. He thought he was just going to keep his insurance and everything would stay the same. So he left his job at Home Depot. He ended up getting hurt, having to have major surgery. And then a few months later, all the bills start piling up and start coming back to him. And they're telling him, well, you were eligible for Medicare. You should have been on Medicare. We're not paying these claims. So he did what any good person does, and he sued Home Depot. But unfortunately, in the end, the court sided with Home Depot. And the answer was, well, you should have known you were supposed to go on Medicare. So that's what we call the COBRA trap. Not understanding what these secondary payer rules, not enrolling in Medicare on time, and then finding yourself in a situation like this gentleman did. And then lastly, there is a little bit of a time period in which a person leaves their employment. You have 8 months to enroll in Medicare after you leave employer group coverage. If you miss that 8-month window, then you have to wait all the way until January of the following year, which is the general election period, to sign up for Medicare. And then if that's been about 12 months, then you're also subject to that penalty. So it's a little bit complicated. Oftentimes, when a person is eligible for Medicare and they're being offered COBRA, it's not usually the course of wisdom to stick with COBRA. Generally, that's only going to be the case if they're taking expensive medications in which private health insurance pays a little bit better, or if there's all kinds of circumstances in which that may be the case, but oftentimes it's not. All right. I think we've belabored that point enough. Thank you. All right. So next. So signing up for Medicare. When do you sign up for Medicare Part B? If you're turning 65, if you're receiving your Social Security benefit, they're going to automatically enroll you in Medicare. No questions asked. You don't need to do anything. They'll send you your card in the mail. If you want to delay Part B, you just fill out the little form that they provide to you, and then you can send it back and they'll disenroll you. But if you're receiving your Social Security benefit before 65, you're going to be automatically enrolled. If you're not receiving your Social Security benefit, then it takes about 10 minutes on the Social Security website, ssa.gov, to make an account and to sign up for Medicare, right? So if you're not receiving your benefit, you have to go to the website to sign up. You can also go in person, right? If you like waiting in line at the Social Security office, and you can do that, all right? And then lastly, right, which is the scenario that we see more often now than before, if you're enrolling in Medicare after the age of 65. So this is going to be completely different. To enroll in Medicare after age 65, you actually need two forms. The first form is the application for Part B, the CMS 40B. Basically, you fill it out, put all your information, and down in section 12, the remarks section, you write that you want your Medicare to start on this specific date. And then secondly, you get a form called the proof of coverage form, the CMS L564, and your employer actually fills that out on your behalf. And you don't want to turn in one without the other. The proof of coverage form is what's going to allow you to not be penalized and also to enroll in Medicare. That proof of coverage form basically proves that you had coverage from an employer from the time that you turned 65. And now you get this special enrollment period because you're leaving group coverage. And you want to do both of these forms, and you can either take them into the local Social Security office. You can, that's what we would recommend, taking it actually into the office, speaking to a living, breathing person, handing it to them. But you can also fax it or send it by the mail. And if you're sending it in the mail, I recommend certified mail, just to verify again that a living, breathing person received your mail, because things do get lost. All right. So now that you have signed up for Medicare, you have your red, white, and blue card, you've made the decision that this is the route you want to go, more questions arise. Which way are you going to go? Medicare Advantage or Medicare Supplement? One thing that we have heard and we continue to hear is folks use these terms, Medicare supplements, Medicare Advantage plans, synonymously. But the reality is, we touched on it a little bit, and we'll get into it a little bit further here, is they're not the same. They can't be further than different. So with Medicare Advantage plans, again, these are fully privatized insurance policies. You still have to pay your Part B premium. Everyone pays the Part B premium unless they're on Medicaid, based on their income. But everyone pays that Part B premium. But when you're on a Medicare Advantage plan, Part A, B, and oftentimes Part D, which is the drug coverage, are all bundled in to one plan, which is administered through that health insurance company. On the original Medicare side, it's more of the a la carte. Right, so you enroll in Medicare Part B, that's the Part A and B, that's original Medicare. You pick a Part D prescription drug plan that makes sense for you based on your list of medications. And then lastly, you choose a Medicare supplement, also known as a Medigap policy, to pick up where original Medicare leaves off. Because original Medicare roughly covers about 80% of your medically necessary services. So instead of being responsible for 20% of X, right, a Medicare supplement will help fill the gap. And the Medicare supplement is different than a Medicare Advantage plan in the sense that it supplements original Medicare. It does not replace it, which is what a Medicare Advantage plan does. And lastly, we don't want to forget this. You can't have both, right? You can't go in both directions. If you have a Medicare Advantage plan, you actually can't enroll in a Medicare supplement plan at the same time. They do not coordinate. It doesn't work that way. So you have to choose one or the other. And that's why it's so important to understand the key differences and some of the similarities. So what are some of these characteristics of these types of plans? Well, we mentioned it briefly. Supplement does exactly what its name implies. It supplements original Medicare. An Advantage plan replaces original Medicare. What does that mean? Well, if you look at line 2 and line 3, with original Medicare, you're not on a network per se. It is federal health insurance. So you can go to any doctor, any provider, anywhere in the United States of America and its territories that participate with the Medicare program. That is 90% of providers and over 99% of hospitals. And you do not need a referral to see any specialist. On a Medicare Advantage plan, you're generally going to be on an HMO, which is a closed network plan, or a PPO, which is an open network plan. Now, with PPOs, right, again, we have to understand what that actually means. A PPO means you do have a network, but you have the option to go outside of that network as long as the provider agrees to the specific terms of your plan. It doesn't mean you can just go anywhere and get covered. The provider has to agree to the terms of the plan. If they don't, even with the PPO plan, you can be responsible for 100% of that claim. And then lastly, with referrals, a lot of these Medicare Advantage plans, they are getting much better. I have to admit, they're getting much better in this sense of many services, you don't need a referral. And the networks are getting much better, especially here in New Jersey. A lot of the big companies have great networks of doctors. But then again, it is still a network. So that's just understanding those key differences. And those are some of the key differentiate. I can't get the words out. That's one of the key differences between these two types of plans. And we mentioned it a little bit earlier too, Part D, drug coverage. With an Advantage plan, Part D is generally going to be built in. There are some Medicare Advantage plans that are medical only. And generally these are tailored towards our veterans who perhaps they get their VA benefits, all their prescriptions through the VA. They don't need drug coverage. So they have these plans that will offer extra things like dental, vision, transportation, and things that aren't normally found in original Medicare, but they leave out the prescription drug coverage. But mainly you're going to get a Medicare Advantage plan with drug coverage built into it. With the Medicare supplement, you have to pick your own Part D plan. It's not built in. Okay, question. Does Medicare Advantage provide coverage if you are traveling in other states, AZ, California, et cetera? Good question, Ann. So Medicare Advantage plans are all going to vary. That's just the easiest way to put it. Not every Medicare Advantage plan has what's called nationwide coverage or national coverage. It all depends. And again, there's about 40 to 50 different Medicare Advantage plans available in each service area, and they're all going to have different perks added into them. So that's why you need to understand them fully if you wanted to go that route. But I will say that some of them do have nationwide coverage. You have to go to the doctors in their network, but you are able to go out of state, which is a relatively new addition. So good question, Ann. Another Ann. In New Jersey, do most docs and hospitals accept Advantage? That's a tough question to answer. Medicare Advantage plans, as we'll get into in the latter part of this slide here, Medicare Advantage plans change every single year. We'll jump to it. Guaranteed renewability for life. We'll answer this question. With a supplement, as long as you stay alive, pay your premium, and stay enrolled in the plan, no one can ever take your Medicare supplement away from you. Even if the company goes out of business or they don't want to do Medicare anymore, they still are responsible for your claim for the rest of your life. If they end up going out of business, you are guaranteed acceptance into any other Medicare supplement to continue your coverage. No one can ever take your supplement away. Medicare Advantage plans are totally different. Although they are, regulated by the government, they're just different. Every single year during the annual election period, providers will come in and out of network with the different carriers. Hospital systems will come in and out of network with the different systems because these are all yearly contracts. Some of them are multi-year, but oftentimes we're seeing yearly contracts with these different Medicare Advantage plans. So do most docs and hospitals accept Advantage? I'm sure they'll accept some, but I don't know if all. And it really is, it's not a one size fits all answer. It would all really depend on your list of doctors. And that's what we do when we help people with their plans. We want to sit down, especially if you're going the Medicare Advantage route. We need a list of your doctors that you see that you would like to continue to see, your medications that you're taking, and that will really help figure out which Medicare Advantage plan may work best for you, which may be more suitable, because it's not one size fits all. I hope that answers your question. And then, is it true Advantage plans cover silver sneakers, exercise plans, and gyms, and Medicare does not? Okay. Advantage plans, some of them do include silver sneakers. Some also include a program called Active and Fit. Some include a plan called Renew Active. Some Medicare supplements also include silver sneakers and Renew Active. More often, we do see that with Medicare Advantage plans, but they are available also with Original Medicare and a Medicare supplement. I hope that answers your question there too, Ann. All right. So we'll get back to these last two here, because these are really important when it comes to the characteristics of Original Medicare and a Medicare Advantage plan. Monthly premiums. Again, we go back to the commercials. William Shatner is yelling at you, telling you need to call this number, this 1-800 number that'll take you to who knows where to sign up for these Advantage plans. That'll get you all the rides to the hospital, and it's not going to cost you anything. That's generally, what we see when it comes to these Medicare Advantage plans. They're going to be $0 per month. Whereas with a Medicare supplement, it's going to be more than $0 per month. We can't really get into the specifics of it, because this is a purely educational event, but roughly here in New Jersey, right, a male, or because it's based on, gender, age, and zip code. Here in New Jersey, male turning 65, one of the most popular Medicare supplements would be around $150. For a female, around $135, turning 65. So that's more than $0. But the flip side of that is with a Medicare supplement, right, in exchange for that monthly premium, your annual out-of-pocket costs are minimal, right? One of the most popular Medicare supplement plans available today, which is Plan G, your out-of-pocket expense is a once per year deductible of $226. That's it. After your first or second doctor's visit, you get a bill in the mail for $226, and that's it. No copayment, no coinsurance, nothing else. Now, with the Medicare Advantage plan, you're not paying anything per month other than your premium to the government, that Part B premium, but you have copayments, coinsurance, and deductibles all the way up to the federal maximum of $8,300 per year. So it's kind of a trade-off, right? But here's also where we'll answer that question in regards to, sorry, pressing too many buttons here, I apologize. Here's where we'll answer that question in regards to why they can offer these plans for $0, right? Nothing in this world is free. But the reality is, every person that signs up for a Medicare Advantage plan, you are now coming off of the government, right, which administers Original Medicare. You're coming off of their books. So every person that signs up for a Medicare Advantage plan, the government pays that company roughly $12,000 a year to no longer be responsible for you, right? And that's just basically how it works. So it's being subsidized by the government in exchange for you not being on Original Medicare and now being your plan managed and administered by the private insurance company. They pay them roughly $1,000 a month. So it makes sense that they're able to offer these plans that you'll have to get referrals for, that you'll have a network for $0, and throw in, a couple $100 for glasses every year, a few $100 towards dental, but then still get you for the $8,300 maximum out of pocket. So that's basically how they're able to offer these plans for free, because they're being subsidized by the Original Medicare program, our federal government. All right. I saw a question come through in chat, I think. I see on Princeton University website that their HR recommends Aetna Medicare Direct for their retirees. Is that a Medicare supplement, or is it a Medicare Advantage plan? So for anyone that's covered under the state employees health benefit plans here in New Jersey, when you retire, it is a Medicare Advantage plan, but it is not like the Medicare Advantage plans that we are talking about here. So if you're a teacher here in New Jersey, if you work for the Board of Ed here in New Jersey, they offer what's called the New Jersey Direct through Aetna, either 10 or 15. And if you have the 25 and 55 to get that for free, then it's a fantastic plan. Even though it is an Advantage plan, it's their nationwide network. You have a max out of pocket of only a little bit over $1,000, and you get great perks. It's a totally different than these individual Medicare Advantage plans that are made available to the vast market. These are actually tailored to the New Jersey state employee retiree. So it's totally different. Now, the flip side is if you don't have that 25 and 55, if you're an educator here in New Jersey, that plan is probably going to cost you over $500 a month. In that case, it's not a great plan, right? Because the cost of what you're paying for it could easily be beat by a Medicare supplement and a prescription drug plan. But if you have that 25 and 55, you're getting that plan for free. People come to us all the time and ask us the same question. If they get it for free, we say stick with it. There's no reason to do anything else. But if you're going to have to pay a premium for it, which is generally going to be over $500, probably not the best choice for you. All right. Good question. I'm going to take a sip of water, and then we'll get into 3 of the most popular Medicare supplement policies, how they work, how they coordinate with original Medicare, and what your costs would be. All right. Okay, so 3 of the most popular Medicare supplement policies: Plan F, Plan G, and Plan N. Now, all 3 of these policies are federally regulated and standardized. So what that means is that what you're seeing here on the screen, this Plan F, it does not matter who sells you this plan. It does not matter which company offers this plan. They are all going to operate exactly the same because they're regulated by the government and they're standardized. The only thing that is not regulated per se is the premium, right? The premium increases are regulated by the Department of Insurance here in each state, but the premiums are going to vary greatly between individual companies. And that's where we come in, right, as senior advisors, because we help people understand that this is the truth and we want to help you find the most coverage for the least amount of money. All right. So Plan F, how does Plan F work? Well, we don't need to get too much into the numbers here. We'll focus on the little numbers. With Plan F, you are basically 100% covered for all of your medically necessary services. With Plan F, Medicare pays their portion. The Medicare supplement pays everything else. You pay nothing, right? This is for in the hospital as well as out of the hospital. So all your medical services. Plan F used to be referred to as the full coverage plan. Unfortunately, if you did not qualify for Medicare before January 1st, 2020, then you can't actually get Plan F anymore. Now, that doesn't mean you had to be enrolled in Medicare before January 1st, 2020, but you had to be eligible for it, i.e. 65. So if your birthday is 1954 and before, you can still get a Plan F if you'd like, all right? It's still available to you. But for everyone else, all is not lost. Plan G is now one of the most popular plans that are available. And the reason the Plan G came about is because I can't remember the exact law or act, but basically, due to the claims, they were like, hey, folks who were using Plan F Medicare supplement, they were overutilizing the system. So now no Medicare supplement policy is able to cover the Part B deductible. So that's where Plan G came in. It's exactly like Plan F, except you as the beneficiary are responsible for the first $226 of your medical claims. So generally what we see now, even if a person is eligible for Plan F, the premium difference is just, too much to deny, right? Plan F, you may end up paying $500 or $600 more in yearly premium just to not have to pay $226. So most people are going to go with Plan G because it still gives you 100% coverage after you pay that $226 once per year deductible. Medicare pays 80%. The Medicare supplement Plan G pays the other 20%. You're 100% covered for medically necessary services. It's great coverage. Another option is Plan N, as in Nancy, or NICE. Plan N is exactly like Plan G Medicare supplement, except on top of that $226 deductible, you're also responsible for up to $20 for every office visit and up to $50 for every emergency room visit. Now, this doesn't mean that every time you go, you're getting charged 20 bucks here, 50 bucks there. That's just the maximum amount that they're able to charge. Some offices charge nothing. Some charge 5, 10, 15, but the maximum is $20 for an office visit, $50 for an emergency room visit. And then also with Plan N, you're responsible for what's referred to as Part B excess charges. Now, this is not very common, and it's also illegal in a number of states. In New York, Connecticut, Washington, and I think Massachusetts, they're not allowed to charge excess charges. But basically, all it is let's say a provider wants to work with Medicare. Generally, if a provider works with Medicare, they accept assignment, which basically means they accept the approved amount that Medicare has for every service. Well, at the beginning of the year, a provider is able to say, hey, I'll work with Medicare, but I want to charge a little bit more. Well, the most they're able to charge is 15% more than that Medicare approved amount. And that's where these excess charges come in. Again, it's not very common. One, they can't pick and choose. They have to let you know. They would have to let you know that they're charging those excess charges. And then you as the beneficiary are also able to see which doctors do this through the Medicare.gov provider search. You can see very clearly all the doctors that accept assignment. And if they don't accept assignment, you won't see that they will. So you'll know that they probably going to try to hit you up for a few more dollars than that is necessary. All right. So those are the three most popular Medicare supplements: Plan F, Plan G, Plan N. And again, these are regulated and standardized. It does not matter who the company is that provides these policies. Generally, right, we are looking for A-rated companies that have stability, because we don't want to have to get to that point where you have to switch because they've gone out of business. But the reality is, whoever provides you these plan letters are going to provide you the same coverage. The only difference is the premium. And that's where we come in. We help a lot of people every single month, every single year, find the appropriate plan for them. And it doesn't cost them anything. Since we're brokers, all of our services are free to you. We're compensated by the insurance companies we work with, and there is no extra fee, right? The plans that we represent are the same plans you would find on your own if you did your own search on the internet. The difference is you have someone like us on your side that's going to be with you year after year. All right. We'll get into our next part, and then we'll answer this question. I'll answer a question right now, and after this open enrollment question, because this is important. When would you want to enroll in one of these Medicare supplements? Well, you'd want to do it during the open enrollment for Medicare supplements. And this all revolves around your Part B effective date, right? So whenever you sign up for Medicare, either it's when you're 65, or if you're working past 65, 70 years old, once you sign up for Part B, you have 6 months to enroll in any Medicare supplement, no questions asked. You're going to be guaranteed accepted into any of these supplement plans that you qualify for based on your age. You will also get another open enrollment period if, let's say, you were on Medicare before the age of 65. When you turn 65, you get another 6-month window to get into any Medicare supplement plan that you qualify for, no questions asked. Now, for a person who's been on Social Security disability, this is huge, because this is generally going to be the last time, the last opportunity to get into one of these Medicare supplements. Because in both of these scenarios, outside of that 6-month window, you have to go through medical underwriting in order to get one of these Medicare supplements. So that basically is the window in which most people are going to enroll in one of these Medicare supplements during their open enrollment period. All right. So, Anne, question. It seems F and G are too good to be true. I appreciate your sentiments there. Yes. And would they cover silver sneakers? So when it comes to these Medicare supplements, the standardized part is what we went over. Some of these carriers, some of the different companies will offer silver sneakers. But that, again, that's not something that's standardized. So even though they offer it now, it doesn't mean they have to continue to offer it year after year. But there are a number of carriers that include silver sneakers in their Medicare supplements. All right. And we can help you figure out which ones those are. All right. Hope that makes sense. All right. You still with me? I can't see anyone, so I'm imagining you're nodding with me. So hopefully. So we're going to go a little bit into our second section here, Part D, prescription drug plans. And again, we're going to touch on the Inflation Reduction Act and the impact that it's going to have, that it's currently having, that it's currently having, and that it will have in the near future. We'll focus first just on how the Medicare Part D prescription program works today. All right. So I know there's a lot of information on this page, but I will try to make it as simple as possible. Okay. Every Part D prescription drug plan is structured like what we see here on the screen. There's 4 phases: the deductible phase, the initial coverage phase, the coverage gap, also known as the donut hole, and then lastly, the catastrophic phase. It sounds a little bit dramatic, but that's what they call it. It should just be cost after the coverage gap, but catastrophic. Most people who are on Medicare and with Medicare Part D start and end their year right here in step 2, the initial coverage phase. The reason for that is because the deductible, although it's $505, for the majority of these plans, the deductible only applies to higher tiered medications. So if you're taking very basic blood pressure, cholesterol, maintenance medications, you don't even have to pay this deductible. You just go right here into the coverage phase, the initial coverage phase, where you're paying a small copayment or a coinsurance. Now, if you are taking a medication that has a commercial or a very expensive specialty drug, then you may be one of the 12% that go into this coverage gap or the donut hole. And how you get into this coverage gap is based on the retail cost of your medication. It's not how much you personally pay, but how much that drug actually costs based on the pharmaceutical assessment. All right. So easy example. The initial coverage phase is all the way up to $4,660 of retail cost. So not your cost, retail cost. Let's use an expensive medication, Xarelto, roughly $1,000 retail cost. In this initial coverage phase, though, you're only going to pay $47 for a 30-day supply. So you go to your pharmacy, you pick it up in January, $47, February, $47, March, April, $47 a piece. Then May comes around, and that same medication now costs $250. And you're like, oh, there must be a problem. This drug costs $47. Well, now because you've exceeded that $4,660 of retail cost, you've fallen into the coverage gap. And in the coverage gap, instead of a copayment, now you're paying 25% of the retail cost of that medication. All right. So that's why throughout the calendar year, drug prices will change. And if you continue to pick up this medication and you exceed $7,400 of another very convoluted calculation, which is called the TRUP, which is the true out of pocket. It's a combination of the pharmaceutical discount, how much you're actually paying out of pocket, and how much you're paying out of pocket. And once you hit $7,400 of that, then you're out of the coverage gap into the catastrophic phase, where less than 4% of Medicare beneficiaries make in a calendar year. And now you're paying 5% of the retail cost of that drug. So now it's going down to $50. Is that good math? I'm not an accountant, right? So again, we can use that example. That $1,000 drug beginning of the year costs you $47. You fall into the coverage gap. Now it's $250, but then you make it out into the catastrophic phase and it's $50 again. And these phases are January through December. It's all in a calendar year. And then in January, it restarts over again. All right. So that's basically how every Part D prescription drug plan works. All of these numbers are going to stay exactly the same. This right here, the deductible, is the maximum. Some premium or some of these policies have no deductible. Some have $100, some $350, but the max deductible is $505. All right. So the Inflation Reduction Act, what change did it have when it came to these Part D plans? Well, back with the previous administration, one of the big changes was called the senior savings model. I'm not sure if anyone here is diabetic or in need of insulin, but for years, especially with Medicare, insulin was one of the most expensive medications to obtain, even though it's one of the least expensive medications to create. All right. And that price has gone haywire for years. But the previous administration implemented, it was an emergency action called the senior savings model. Insulin that were covered under these specific plans could not be more than $35 for a 30-day supply, no matter what. Well, with the Inflation Reduction Act, that emergency action or that emergency authorization, whatever they want to call it, was written into law. So now insulin is $35 for a 30-day supply if it's covered under the particular plans. And then what also changed at the start of this year was vaccines. Before, right, you could get your cold, you could get not a cold shot, who gets that? You could get a flu shot and it would be covered under Medicare. But if you went to get a shingles shot, which wasn't covered under Medicare, you now have to pay into your Part D prescription deductible, where you're paying, a couple $100 every time you go because it's a 2-part shot. Well, now, starting in 2023, all recommended vaccines are covered 100% under your Part D prescription drug plan. So you don't have to have any copayment, no coinsurance. It's all covered. And actually it falls under Part B of Medicare now. Another thing that's happening next year is this Part D premium stabilization. Now, this is key. If any of you have been on Medicare for a while and you've been enrolled in your Part D prescription drug plan, you'll know that year over year, even though some plans go down in premium, the majority of them go up, right? We saw some plans this year go up 50% in premium, some over 100% in premium. Well, this Part D premium stabilization means starting in 2024, no Medicare Part D prescription drug plan is able to go up more than the rate of inflation. So for this first year in 2024, they're basing that at 6%. So no premium is going to go up more than 6%, which is good, which is a good thing because there's no reason that a plan should go up 50, 100%. It doesn't make any sense. Another thing that's happening in 2024 is that the benefit levels are going to change. And I'll show you what that is right here. We don't necessarily have the numbers yet when it comes to the deductible or the initial coverage or the coverage gap. But what we do know is for that 4% of beneficiaries that end up exceeding the coverage gap and going into that catastrophic phase, their cost share is now at $0. So if you end up getting into the catastrophic phase of your Part D prescription drug plan, you have no more out of pocket. Again, that's less than 4% of Medicare beneficiary, but I know for a certainty, I have at least 5 clients that I work with that go through all 4 phases in the first 2 months because of their expensive medication. So that's going to be a huge benefit to them and perhaps to you as well. Now, another change that's happening in 2025 is this entire structure is actually going to change because for the first time, the Medicare program is going to have a maximum out-of-pocket limit for prescription drugs. So instead of all these, these different phases and all that stuff, once you hit $2,000 of out-of-pocket, right, $2,000 of what you pay nothing else. All right, this is the first time that the Medicare program is implementing this. It is going to be not income adjusted. It will be inflation adjusted. So every year it may go up, but for the first year in 2025, once you pay $2,000 of out of pocket of your own money, you pay nothing else. All right. And then lastly, the last thing that the Inflation Reduction program put into place was this drug price negotiation. So for years, right, since Medicare has been implemented, Medicare has never negotiated any of the pricing for their medications. So the price that they get from the pharmaceutical company is what gets priced out to the insurance carriers that do Medicare Part D plans, and the price is what the price is. Finally, now Medicare is starting to negotiate their own pricing for these popular medications. They're starting with the first five or 10. We'll know this next page. They're starting with the first, there we go, 10 most popular Part D prescription drugs, negotiating those prices. And then they're going to go up to the most popular 15 Part D prescription drugs, and then a combination of Part B and D, and then 20 of the Part B and D drugs. And the difference between these Part B drugs are generally medications that are administered in an outpatient facility or at a hospital. So like chemotherapy, kidney dialysis, any type of infusion therapy falls under Part B of Medicare. Part D is generally prescriptions that you would pick up at a pharmacy and take home with you. So they're going to start, they actually started the negotiation of these plans or of these medications, but they don't go into effect until 2026. So that's a huge win as well. And hopefully those cost savings will get passed down to you as the beneficiary, or they should. That's how it's designed. What we'll be able to do generally, we do like a little demo here of how we find the most popular Medicare Part D plan for you. But I'll provide a little link to our feedback form. If you'd like a copy of these slides, as well as the video here of how we find the most appropriate Part D plan, just fill out the feedback form, and then we'll be able to shoot that over to you. All right. And then here's just a couple of the programs that we really enjoy when it comes to prescription assistance, because drugs are very expensive. The two ones that we focus on a lot are New Jersey specific. New Jersey PAD, which is pharmaceutical assistance for the aged and disabled, is an excellent program. If as a single tax filer, you're under $42,000, and as a joint tax filer, you're under $49,000, New Jersey PAD will not only cover your Part D prescription, your Part D plan premium, but they'll also lower the cost of all covered brand name and generic medications to $5 or $7. So it's an excellent program if you happen to fall within that income bracket to get coverage through the state of New Jersey. It's an awesome program. It's very easy. It's intense to apply, or it's a number of pages, but once you get it in, they're very nice to work with and super helpful. If your income's a little bit higher, then Senior Gold is another great program available through the state. I think it's about $10,000 more, but Senior Gold, you still pay your Part D premium, but they'll actually discount your medications, right? So they give you, I think it's $15, anything over $15, it's like a 50% discount on your prescription medication. So two really excellent programs available specifically here through the state of New Jersey. All right. And then there's also these basic websites that aren't insurance, but they're coupons. And these are coupons that you would use in place of your prescription drug coverage, because I don't understand it fully, but sometimes these coupons are just more cost effective, or they're cheaper than using your prescription program. That's a whole nother conversation as why these medications are so expensive. All right. Okay, one more question. And where can we get dental or eyeglass coverage on standard Medicare? Okay, great question, Ann. You have a lot of good questions, actually. So original Medicare does not cover standard dental or vision services. They will only cover it if it's medically necessary. So when it comes to eye care, they're talking wet macular degeneration, cataracts, glaucoma. Medicare will cover those types of services. Or if you need to have any teeth removed or any dental work because of an upcoming surgery or some type of treatment, then they'll cover that. But for the most part, you would need a separate standalone dental and vision policy to get that coverage, because original Medicare does not cover that. Some Medicare Advantage plans do include some dental and vision services, So that is one option again as well. But original Medicare does not cover that. All right, good question, Ann. Okay, so now we reached the end, and we're just going to recap quickly the top 5 mistakes that people make on Medicare. We touched on a number of these throughout our presentation this afternoon, so we'll recap that. All right. The number one mistake that folks make when it comes to Medicare is not enrolling in Medicare Part B on time, right? Either enrolling late and accruing the penalty, or enrolling early. Let's say they're covered by a large group health plan and they enroll in Part A and B. And again, Medicare is a horrible secondary. So now they're, in essence, throwing this money away because they're never going to get their return in claims based on that premium. Doing it too early, doing it too late, not enrolling on time, Medicare Part B can be a huge problem. And again, that penalty for enrolling late is 10%, not for a month, not for a year, but for the rest of your life. All right. So enrolling in Medicare Part B is important. The number 2 mistake, not analyzing Part D prescription drug coverage. We talked to a lot of people, and some folks have been on the same Part D prescription drug plan for the last 5 or 10 years, and they've never covered. They've never taken a look at it. And again, these premiums, some of them have gone up 50, 100% year over year. So if you're not taking a look at it, you could be paying thousands of dollars more than you have to. Understanding the difference between standard pharmacies and preferred pharmacies could cost you thousands of dollars, right? And over the course of a lifetime, it's just a lot, right? So understanding that every annual election period between October 15th and December 7th, you're able to take a look at your Part D prescription drug plan and make a change. We do thousands of these reviews within a 7-week period. And we keep track because we like to know the numbers. So this last year, between our clients that we helped, I think we did about 4,000 of these reviews. And between those 4,000 clients that we worked with, if they would have kept the same plan and not switched to the plans that we recommended with different carriers, they would have ended up paying more than $4 million more than they had to, right? And that's just from switching plans, nothing crazy, just finding the right plan and the right pharmacy and doing that, right? So it's important to analyze your Part D prescription drug coverage every single year. The number 3 biggest mistake is not understanding the difference between Medicare Advantage and Medicare supplements. Again, people use these terms synonymously, but we know they're not the same, right? We went over some of the key differences. Understanding the difference between networks and referrals, looking at the overall expense, not just the monthly premium, and then looking at, the maximum out-of-pocket expense. This is huge because, if you want to do a correct calculation of what type of insurance you're going to have, you want to calculate it worst case scenario, right? If everything were to hit the fan, how much would I have to pay with this? How much would I have to pay with this? As well as the peace of mind of where am I able to go with this, or which hospital am I able to go to, or which clinic? Looking at all of these before you make a decision is extremely important. Medicare is not one size fits all. I know I may sound like I lean heavily towards the Medicare supplements because in my personal opinion, I think they are much better insurance, but we help folks with all aspects, right? I help a lot of people with their Medicare Advantage as well, because that may be the situation that's most suitable for them. So there is no one size fits all, but understanding the difference is what's going to help you make an informed decision. Number 4, not analyzing retiree coverage. We talked a little bit about this, right? Not all retiree plans are built the same. With that educators retiree plan here in New Jersey, if you have the 25 and 55, that Aetna Direct Medicare Advantage plan is fantastic. If you don't have 25 and 55 and you're paying $500 or $700 a month for that same exact plan, it's not so good, right? So looking at your retiree plan subjectively, again, not just the premium, but looking at the overall expense. What are the co-payments like? What are the co-insurances like? What's your maximum out of pocket before you don't have to pay anything else? Looking at all of that will help you to see, like, hey, does it make sense to keep this retiree plan? Or is there the sentimental attachment to it? Or could I get better coverage, save money with original Medicare and a supplement or Medicare Advantage plan? Understanding that option, giving us a call, we can help you with that, is going to help you make a good decision. And lastly, the number 5 mistake that we see is listening to our friends and our family. Now, we kind of say this jokingly, but we should also add William Shatner and JJ Walker. I don't know if you saw this year, but they also got Lionel Richie selling Medicare Advantage plans now. So all of these, all these folks, they may, they're trying to sell you a plan that you may or may not need, right? So when it comes to friends and family, they may love you. They may say, oh, my plan is the best. But as we've discussed, there is no best anything, right? Medicare is not one size fits all. Everyone's situation is different. The drug plan that your neighbor has is probably not the same drug plan that you're going to have. Oftentimes, even with husbands and wives, they're not on the same drug plan because they're not taking the same medications. So even though our friends and family, they may love us, they may have, our best interest at heart, they may not know the full spectrum of it. So it makes sense to go to those who do. And that's what we do, right? That's what we do every single day. And that's what we've done for the last 15 plus years in this Medicare space, helping folks like yourself who have questions about Medicare. And again, all of our services are free. There's no fee to work with us, but we would love to chat if you have any questions. I'm actually going to throw in the, hold on one second. I'm going to throw in the chat box our feedback form because we really, really appreciate, let's see. I don't know if I'll put it into Q&A actually. We really, really appreciate the feedback from folks. If you enjoyed the program, let us know. If you'd like a consultation, you can just give us a shout as well. And then we'll also be able to send you a copy of these slides as well as the video showing how we find the most appropriate Part D prescription drug plans for you and for all of our clients. All right, and we have a couple more questions before I let you go. Let's see, answered that. Judith, are audiology services and hearing aids covered to any degree in original Medicare? No, unfortunately not. Hearing aids are not covered under original Medicare, and there's really not any plan that does great with coverage for hearing aids. There's a few dental policies that have like a smaller rider for a couple $100 towards hearing aids every year, but nothing substantial at the moment, unfortunately. And then with a Medicare Advantage plan, some of them do have smaller co-payments when it comes to hearing aids. So they'll give you like a hearing test generally for free, and then they'll give you a couple $100 towards hearing aids as well. And then lastly, let's see. Okay. Thank you, Dana, for putting that on there for me. You should see the feedback form on there now. I don't know how to use the chat. Thank you. Okay, Joan, sorry. How Medicare doesn't cover car accidents? I don't necessarily know what that means, Joan. I'm sorry. Maybe you can rephrase that question. I'm not exactly sure what that means. Karen, can debt ceiling in Congress affect Medicare? Sure, it could, but it's probably not going to have an effect. And the reason for that is, again, Medicare is a pay-as-you-go system. Medicare is paid out of a completely different fund. And surprise, surprise, healthcare funding doesn't really have a limit here in the United States of America. So it kind of just goes on in perpetuity. So the simple answer is no, I do not think so, that this debt ceiling will have any effect on Medicare. It may have an effect on the payout for some Social Security benefits, but I think they're working on that as well. But Social Security does also come out of its own trust and its own kind of money pool. But at the moment, no, I do not think the debt ceiling will have an effect on Medicare as the program as a whole. All right, I think I answered everyone's questions, and I think everyone can see the feedback form again there. Again, if you have any questions, you can find us on LinkedIn. You can find us on Facebook. Our YouTube is also where we put out a lot of information. As soon as there's any changes in the Medicare system, usually Justin, he likes making videos more than I do, likes to put videos out there so that anyone who follows us, any of our subscribers, will have up-to-date information on what's going on. And yeah, I just want to say thanks again for taking time. And thanks, Dana, for having me.
Thanks, Rod, so much. Your presentation, always informative and very helpful and thoughtful. So we appreciate that greatly. I want to thank Rod, I just did, but I also want to thank everybody who attended and was very flexible in pivoting to a virtual only format near the end there. I also want to thank Princeton Senior Resource Center, who partnered with the library to host this event. We do have someone from PSRC here now. Joanna, did you want to say a few words?
Yes, I did. Thank you so much. It's been an honor partnering with Princeton Library and also with Roderick from Senior Advisors. You know, at PSRC, you know, we believe it's important to know about your benefits, about Medicare, the differences between the Medicare versus the Medicare Advantage plans, such as Roderick talked about. And, you know, we want to know from you if there's something more specific that you'd like to talk about or you'd like for us to present on workshop wise, and we can work on more of that in the future. So please feel free to reach out to us. We're very happy to help. Thank you for having us.
Thanks so much. I'm going to leave the everybody, you know, feel free to leave if you'd like. I'm going to keep it open a little bit longer and make sure everybody who wanted to is able to capture the link that Rod put in the chat near the end there. So you still have a little bit more time, but thank you all so much.
Thanks, Dana. Do you mind if I send you my email address too? I realize it's not on there.
Absolutely.
And then we also had one more question. I'll answer it really fast. Here they go. From Joan. Okay, so Medicare doesn't pay for consequences of car accidents. Your car insurance pays for medical related to accidents yet. Okay. So Medicare actually is supposed to cover car accidents. Anything related to hospitals would fall under Part A of Medicare. So that includes you know, medical transportation, that includes your treatment in the hospital. Part B would cover like emergency room treatment and x-rays if that ends up being the course. Yes, please, Dana. Yes, please. Thank you. So unless you have a particular situation in which that didn't happen, that's a bit surprising. But original Medicare, yes, they are supposed to cover anything related to accidents. There isn't like a differentiation between that. There may be some coordination perhaps with your car insurance, but Medicare covers hospital, Part A, and then medical, Part B. That's what we got there, okay? But you can give me a call or send me an email if you have a specific question. Maybe we'll dive a little bit into your specific situation. That'd be interesting to find out.
Thanks, Rod. Really appreciate it.
Yeah. Thank you, Dana.
Thanks again to everybody. I hope everybody has a great rest of your day.